It's an opportunity to change healthcare. Not necessarily from saving lives. I'm not on the operating table, but at least from a marketing aspect, what I know how to do, how cool would it be just to change the way that marketing is done?
Healthcare marketing is notorious for lagging behind the times and is long overdue for a checkup. But one health company's transformative marketing approach might just be what the doctor ordered. Today, we're pleased to welcome Andrew Chang, the Vice President of Marketing for the multispecialty medical group Summit Health and urgent care provider CityMD. The two companies merged in 2019 to form a combined organization that spans the spectrum of healthcare needs. Tune in to hear Andrew explain the company's unique business model and data collection strategy are helping unlock the true potential of healthcare marketing. And before we get into the podcast, I want to give a special shout out to our partners at Salesforce. Salesforce brings marketing and engagement together. Learn more at salesforce.com/marketing. Now let's get into it. Andy, I'm pumped to have you on the show, man. We've had some great executives on this show, and I'm just excited that we got to get some of your time, man, and learn about kind of what you're up to. So what are you kind of most excited to talk about right now? Like, what's happening in your world where you're like, this is what I'm paying attention to, this is what I could riff on about? What's that for you right now?
Yeah, that's something that I've been thinking about and working on a lot about lately. I would say right now what gets me really excited is creating ways to give marketing more credit for the revenue that the team brings. And the reason for that is because a lot of times, especially in healthcare, and healthcare, as we all know, is a giant industry, marketing tends to lag about 10 years behind, maybe even more, than where we should be. And so marketing 10, 15 years ago was not necessarily being seen as the people who bring revenue to the company or to the organization, and really more as, and I'm oversimplifying here, but a creative services team and a team that builds pretty things, cool looking things, or just prints cool things or brochures, what have you. And so what we're doing at Summit Health and CityMD is creating an attribution model and collecting a lot of data and analyzing that data so that we're able to say, hey, marketing contributed this many incremental patients or this many incremental revenue dollars in the last month or the last quarter, and sharing that to the C-level and also our business partners to help change the way that marketing is perceived. And so it involves a lot of data, it involves a lot of process, it involves a lot of education, a lot of re-education, a lot of behavior change and change management. That kind of stuff is what excites me.
I love that. I love that. That's come up a couple of times in other industries as well, where a marketing leader like yourself is really fighting for this perspective, this change around how stakeholders view marketing as this. Right. Back in the day, it was this cost center, it's creative, but now folks like you are like, well, actually no, we can attribute revenue, we can show you how we're growing pipeline, how we're expanding the product experience, etc. So it's people like you actually that are kind of, and especially as you said it well, healthcare is, in many ways, there's parts that are old and stodgy and kind of still catching up to a lot of other industries. And you're there, saying, "Hey, we have to put a flag in the ground here and say, look, we're driving revenue." Can you tell us an example of how you're doing this? An example of how you've been able to do this well at Summit Health CityMD?
Yeah. So we have a performance marketing director and an analyst who work very, very well together, who understand what we're trying to accomplish and have done this before at other bigger companies. And what we're doing is basically, if we're not looking for 100% accuracy, because that's a pipe dream. That is the holy grail, right? 100% accurate attribution. But what we're doing is something a lot more accurate than 50%. So I'd say we're about 75 to 80% accurate. And that might be on the high side. Just let's call it around 70% accuracy. And we're doing that based on the channel that people are coming in. So CityMD, we're a walk-in service. You can't book an appointment. And so what we're doing is using anonymized data from cell phones to tag people that who have seen our ad or interacted with our ad or engaged with our website and seeing that device come into our location for an extended period of time.
Ah.
And what we do is take that data and have it against a control group, people who have seen the treatment but still didn't come in versus those who have seen the treatment and did come in. What's the incremental lift? And so what we're seeing is there are some of our ads are working, some of them are not. Some of our locations are getting affected, some of them are not. And so that's kind of our walk-in business. Our Summit Health side of the business, where you do have to make an appointment, it is a little bit easier, but also still complicated because most of our appointments are done via our call center. You have to phone it in to make an appointment. And so we're using call center and call tracking analytics to make sure that we are able to tie phone numbers to specific treatments of creative to channels, et cetera, and then saying, hey, this phone number that showed up on this place drove incremental revenue versus a control group that we had, et cetera, et cetera. And so we built all these different types of models that show the
Mm.
incremental lift, and that's how we're doing it.
That's awesome. Do you create your own dashboards to look at that? Are you like kind of
Yeah,
custom dashboards all the way? Yeah.
yeah. We did create our own dashboard. So we pull in data from Google Analytics. We
Okay.
pull in data from Salesforce. We pull in data from our ad agency. We pull in data from our third-party companies that I just told you about,
Uh-huh.
Cubic and CallRail for attribution. We put it
Cool.
all in one place, and our analyst creates a lot of dashboards for us.
Awesome. That's great. I interviewed the CMO of CallRail. Great. That's a great business,
Oh,
man. They're great. Yeah. They're
yeah,
incredible.
yeah.
Okay. So in terms of the two different sides of the business, you have the walk-in side of the business, you have the appointment side of the business. Are those pretty equal in terms of driving revenue, or is one like a larger part of the business and the other is like the bigger opportunity, or how does that look? What is that like?
They're pretty equal. During COVID, I would say our urgent care business, the CityMD side, obviously blew up a little bit
Okay.
and had definitely its fair share of challenges, but also opportunities. And it did we did a lot of volume, but ideal state, which is where we're around right now, is about 50-50.
The website talks about there being over 200 locations, 2,000 providers that cover this kind of multi-specialty urgent care connected,
Yep,
all connected together. So those
yep.
200 plus locations, that's both of the, like some of those are appointments, some of those are walk-in.
Yeah, so we have like
Ah, okay.
160
Okay.
CityMDs,
Cool.
and we have quite a few dozen of our Summit Health locations,
Okay.
and just continuing to grow.
There's a lot of urgent cares out there, right? So that's an interesting world. There's a lot of, I know, just to here in Austin, Texas. I mean, you drive around, there's a lot of different people that are, a lot of dogs in the fight, so to speak.
Right.
But there's something different about Summit Health City MD. Like, what is this? What's like the value prop on like each of, like for both of these businesses? They're at the highest level. They're like a lot of other businesses that are similar, but there's something different. What's the nuance that makes like this business so interesting in a space that could be a lot of people in it, a lot of different businesses in this?
I think the joining of the two brands in 2019,
Ah,
CityMD and Summit Health,
okay.
was a really good move because what we see in healthcare is a shift to more retail-based care. And CityMD, being the largest in the New York region, is well positioned to grow even faster and expand a lot further out because they've built a machine pretty much that knows how to take care of patients quickly. They know how to do it efficiently, and that's what patients want at the end of the day, right? You're not going to an urgent care just to hang out and get some work done with some coffee,
Hmm.
talk with friends. You're there because you have to be there,
Right.
or you definitely don't want to be there. And the last thing you want to do is, again, spend a single second more than you need to. And so the City MD team did a really amazing job of just making sure that patients are always at the center of everything that they do. I really mean it that way, and just make sure that the experience is hassle-free as possible. On the
Wow.
Summit Health side, um, it's a primary care to OBGYN to cancer or orthopedic surgery. We handle all of that as well. And so the idea was, how cool would it be to connect an urgent care, which is everywhere, to um, more of a long-term care structure where it's more of a relationship-based care,
Hmm.
and combine that into one experience where all of your health records are in one place. And again, it's really about striving to be the yes in healthcare and not necessarily what patients might be used to hearing in healthcare, which is a lot of no's. Why can't my record just show up on this doctor's office? Or why
Wow.
can't
Okay.
I just go to this urgent care and my flu vaccination or COVID
Uh-huh. Uh-huh.
test is automatically uploaded? And so we're breaking down a lot of barriers to have a much smoother and better experience at every step, even when you're not inside of our four walls, to make sure that we have as seamless experience as possible. And I think that's what really sets us apart.
Wow. So this term relationship-based care, is that an industry term or is that something that you guys created internally?
I don't think it's an official term, but
I
a lot
like
of
that. I haven't heard
healthcare
that.
companies say it.
Okay.
Yeah,
Okay.
we see it. You have a relationship with your primary care or
Mhm.
OBGYN
Mhm.
or oncologist. You have a relationship. And for CityMD, you may not necessarily have a relationship with the provider that's seeing you at the time because it's walk in and you're in and out. But again, it's the continuity of care, right? Doesn't matter who
Mm.
you see. We're going to always take care of you from every step of the way. And so we go from transactional to relationship based care,
Wow.
and we try to make it as one team. Again, with the idea of making it as seamless as possible.
Wow. So is the idea to is it you acquire other urgent cares and then turn them into City MDs? Or are you launching just new City MD locations or launching new Summit Health locations? Or is it acquisition?
Yeah, it's both. It's both.
Both.
We
Okay.
are opening locations. We're opening quite a few every year.
Okay.
And because when I joined almost 2 years ago, we had about 130 locations. Now we're up to about 160.
Okay. Wow.
And those were done through building our own and acquisition. And then on the
Okay.
Summit Health side, it's also both. We're building new facilities. We're opening a big one in Clifton, New Jersey. We're opening a pretty big building in New York, and also
Wow.
acquiring practices that have practices that are already established throughout the city.
Wow, that's so awesome. So all of this data that you're collecting on the existing businesses, that's got to inform like new opportunities and new locations. It's got to make that a really interesting process because you have so much
Yeah,
to see, right?
yeah. We have an amazing real estate and business development team that uses data all the time. I mean, the way that they plan out and see where there's a lack of care and where we could do a better job and fit in. It's just impressive to see how they use the data and see how the traffic patterns work
Yeah.
and all these different things that they use. So
So I want to take a mini step back, Andrew, because like according to your LinkedIn, you've got nearly 2 decades of marketing experience.
yep.
You've landed at some amazing places, and again, I see a human like you. I see the experience you've had, and in many ways, you can go into a lot of different industries and spaces and play and do well. What inspired you to join Summit Health? Like, why Summit Health, City MD?
I used to think and really believe that marketing is marketing, and it's a process that you can follow. Doesn't matter what industry you're in, and so might as well get as much experience in different industries and see how it goes. So after being in the airline industry for 8 years, my boss at the time told me you should not be in the airline industry anymore. You should start to expand, and so that's where I really wanted to look at logistics, and UPS came in, and I worked there for a while, and then after that went into commercial real estate, where I ran marketing and PR, and that's where I actually discovered industry did matter because it was really more about not me becoming a good marketer, but it was really about the feeling of being able to change industries where marketing could be
Hmm.
modernized. And commercial real estate and real estate in general is definitely one of those. And then healthcare, like we talked about before, is a little bit of a giant gorilla, and dinosaur, an ancient gorilla, whatever.
Mm-hmm.
And to be able to be in a sector like healthcare and change the way that marketing is done for an industry, to me, that is what's cool. And so that's kind of how I wasn't always setting out to work in healthcare. My boss at the time at Piedmont in Atlanta, Matt Gove, who was the chief marketing officer, invited me, and he had the same vision. And he's also my boss at Summit Health City MD, by the way.
Ah.
He, kind of showed me that realization about how behind marketing really is and how we could change it. And so that's what really excites me. And
Wow.
that's kind of healthcare for me. It's an opportunity to change healthcare. Not necessarily from saving lives. I'm not on the operating table, and but at least from a marketing aspect, what I know how to do. How cool would it be just to change the way that marketing is done? That's
Yeah.
kind of what my driving force is.
Now, I want to know about, because so Piedmont, I mean, it's a huge company. I mean, 12,000, Piedmont Healthcare is like 12,000 plus employees, like very big. You now are at Summit Health, CityMD. I think you guys are just under 2,000 employees. So
Yeah, well,
what
13,000 now.
is it
We have
13?
2,000. Yeah, yeah, yeah. We've got 2,000 providers, but like 13,000 employees. We're growing. We're
Wait,
growing.
Summit Health does?
Summit Health and CityMD combined.
Oh,
Yeah,
wow. Okay, okay. Because I know it said Summit Health was like 1,300. It was like 1,379 on LinkedIn, but it's 10 times that, you're saying. Okay.
yeah,
Wow. Okay.
yeah. We need
So
we need help on our LinkedIn strategy too,
okay,
obviously.
okay, okay. So, as I look at your career, Andrew, you said you had some cool experience. You spent time at Nielsen, which I love that as like a good foundation of marketing. And then you went on to
Hmm.
Deltagen and Cellmania, ended up at AirTran, then UPS, which by the way, I interviewed Kevin Warren, who's the
No,
current
yeah,
CMO of UPS, one of my all-time favorite executives, just a great human being. And to see some of the things UPS is doing as a brand, as old
yeah,
as they are, right? And the moves
yeah.
that they're making. I love that. And then you ended up in healthcare at Piedmont after Stan Johnson Company, and now at Summit Health. But what was the shift from like marketing like contributor for you into like marketing leader? Like where did that happen for you? What was that process like? Because every good marketer doesn't necessarily become a good marketing leader, and that's a big shift. So where did you start to make that transition, or notice like, hey, I want to go there and start to become and cultivate that marketing leader that you are? When did that happen?
That's a great question. I would say that happened probably. I was lucky enough to have that kind of realization earlier on in my career, probably at AirTran Airways,
Okay.
when I inherited the frequent flyer program. AirTran Airways, just so you don't know, is an airline that it was a top 10 airline, got acquired by Southwest Airlines in 2011-ish, and went on to work there for about a year. But it was an amazing company. I had really good support from above and below and all around, and it was there where I realized, I could do the work, and especially in an area like marketing analytics, which wasn't as popular at the time, in the first decade of 2000s. I could do the work, but at the same time, if you really want to drive change, it's really about learning how to interact with people and learning how to sell to them, sell internally, build relationships, and really try to make change, because that's the way that you're going to get your own people, your own team, to be able to grow and learn and rise and accomplish their goals as well. So
Mm.
I think it was honestly just it was shown to me because that's how my boss treated me at that time, and that's how I wanted to kind of grow my career is to kind of go into more of a leadership role, have more influence, and be able to change lives, hopefully in a positive way, from a career standpoint.
Wow, that's awesome. I mean, and I think that's a topic that I want to. I'd love to get your kind of feedback on, experience on how you can make change as an executive, how you can influence, executives and other stakeholders and support them and protect them, and vice versa. I love to just kind of know your thoughts on that. And it's interesting. If you go to the AirTran website, it goes straight to Southwest. So
Yeah.
it's now Southwest. It's you can't book a flight from AirTran now, but
No,
um, that's cool.
it's
So
sad, but yeah.
so,
I'm
so
surprised you even tried. I'm grateful.
yeah, yeah. It goes straight to Southwest. So they definitely have that domain name. So yeah, I mean, so in that frame of like how to make change, and like what are some of the things that you've kind of taken along the way for, when because you've got to sell initiatives, you've got to create really good trust and rapport with your stakeholders. How are you doing that now? What are some of the things you've learned and how to do that successfully as a marketing leader?
That's probably something I learned a lot from UPS. They have an amazing career development program there, and they really do take the time and invest a lot of effort and energy and money in making sure that their employees know how to become better at whatever job they want to do. And so, number one, it's about being able to tell a story from the data. Anyone could access data, anyone could play with data, but not anyone could tell a convincing story with data. And being able to tell a succinct elevator pitch without even having to use the numbers, but knowing that all the words that you're using are coming from numbers, I think
Mm,
is critical. So, one example of that is if someone asks, what's the weather like right now? And someone answers, well, barometric pressure is at 48, humidity is at 62, the temperature is at 79, the wind speed's at 7.6 miles per hour southwest. Great. I just want to know, is it nice? Is it a nice day or does it suck? The weather's it's a great day outside. That's the answer, right? But you're still giving a succinct answer using the numbers, using the data that you have collected, but you don't have to use those numbers as part of the
mm.
answer. And that's kind of what UPS taught me, being able to sell internally to other executives, answer the question, but do your research and know that whatever you say is based on fact or anchored towards a fact, right?
Mm.
And be confident on how you deliver it because you've done your due diligence. And so being able to do that time and time again is builds credibility for yourself, and eventually people learn to trust you.
In the kind of vein of like just your marketing strategy, I'm curious where like experimenting and like kind of R&D go in terms of marketing. Like how much time, if any, is the marketing team at Summit Health, CityMD like testing new things, experimenting, like thinking down the future of like how patients and people are going to interact with, the technology and the service. Like, do you spend a lot of time, in the future and testing things out that way, or what's that look like at Summit Health CityMD?
That is a very hot topic in healthcare within the marketing and product teams and IT teams. Like, can we have virtual care with wearable devices with, and I'm making stuff up here, but like a robot that comes to you and takes your blood test, and your results get scanned into your phone and whatever. I would say that there's a lot of cool possibilities in healthcare, and Apple, for example, right? There's the Apple product reveal that just happened actually. They're getting more and more into wearable tech and health,
Mm-hmm.
and Amazon, they're getting more and more into healthcare and delivery and pharmaceutical delivery. And so there's a lot that's possible, but what should we actually be focusing on as a company? And so our product team does a really good job at noticing trends, assessing the feasibility, and then on top of that, assessing patients, or do customers really care about this? It sounds really cool, but at the end of the day, just because it sounds really cool, does it mean that people are going to actually use it or want it, especially if for something as personal as your health? And
Mm-hmm.
so there's a lot of famous failures, I'm sure there's a lot within healthcare, but we are always looking at how do we make the experience, and what we do is focus on the experience of what someone goes through when they
Mm.
interact with our brands. So is there technology that can make the experience a lot easier? What are the pain points that our patients are going through, and how do we use technology to kind of solve those pain points, but again keeping in mind that the patient's the center of everything, and
Mm-hmm.
and how do we use technology to enable the patient as opposed to just saying, hey, that looks really cool, we should try that.
So, Andy, what's like something new that you're working on, something that you've launched recently? And yeah, tell us about that.
So something that we just launched about a week ago is our CDP, customer data platform, with Salesforce. We just launched the first MVP version last week, and we are now collecting a lot of data being fed into our CDP to create segments, and we're going to use those segments and use that to um, combine it with their interaction studio that Salesforce has, another tool which is all about personalization and being able to serve content, being able to target content, being able to serve ads or emails to different specific user groups that we have identified from a business perspective that we have prioritized. So, for example, what
Wow.
we are now doing is some identifying people who have not seen their primary care provider over 24 months. How can we target them, and how do we find them, and how do we find more people like them, and be able to grow our business, and vice versa, people who look like they have a certain type of profile that we're looking for. Maybe their BMI, or they used to be former smokers, or what other segments can we create using anonymized data to be able to target and grow our business. And so we have a lot more coming. We're going to be fully launched in about a month and a half with Interaction Studio and CDP with Salesforce.
Wow, that's huge. Well, shout out to Salesforce. That's also not surprising to hear how much innovation is happening at that business. I mean, they obviously sponsor our show, so I love hearing about what they're up to. But that's awesome. Thanks for sharing that. So, who would you say are like the customers of Summit Health City MD? You've certainly got patients. You want to find the facilities, but like, who would you say are your customers?
We have different groups of customers. Number one is obviously the patients.
Uh huh.
Number two is other doctors,
Okay.
doctors that refer their patients to us.
Okay.
And their experience, if we're still in an industry where faxing is required, keep in mind,
Ah.
right? So how do we
Yeah.
make the experience of doctors and their staff and other nursing staff and providers or other office staff, how do we make an experience to refer their patients to us? Without having to fax anything for once, or getting a printout and taking a picture of it and then mailing it. It's pretty embarrassing at times. And so that's another big group of customers that we have. Another is employers. A lot of employers are definitely worried about employee health,
Mm.
from a mental and
Mm-hmm.
chronic disease and every aspect. And so how do we build relationships with employers so that their employees can get taken care of in a, again, easy way where the cost is a lot less than what they could potentially be doing on their own, and making it a lot easier for the companies to be able to manage costs. So that's another
Mm.
group that doesn't
Okay.
really get talked about that often.
Awesome. Okay. So patients, other MDs, employers, that's kind of your big customer buckets.
Yeah.
Wow.
Yep.
Okay. Awesome. So in terms of how employers would work with you, is that that's on the Summit Health side of things, like where someone would kind of
Yeah.
like is it like you're setting up a clinic like for a business, or like you're setting up a place for them to send their folks? What does that look like actually?
It could be both, and it could be for both
Ah.
brands, CityMD or for Summit Health. Like if you need to do a
Oh.
drug test for our new employees and you don't want to do that yourself, you can
Okay.
send them to a CityMD at one of our 160 locations.
Got
If you
it.
want,
Okay.
if you have
Cool.
occupational health issues, you can send them to either brand. For Summit Health, yeah, we could have. It could be that entire range. We could have a dedicated office inside a big corporate headquarters, or
Yeah.
we could have exclusive, easy access to see a Summit Health provider that's convenient to them during work
Okay.
hours or during their work day, even if it's
Mm.
close to their house, what have you. Um, there's a lot of white space that I think could be explored in this area, and so I don't think anyone's really cracked it yet. I know
Uh-huh.
Amazon and J.P. Morgan, they and was it Google or no Berkshire Hathaway? They tried to crack it and failed. So there's a lot of opportunity.
Is telemedicine, are you seeing a big swing in telemedicine like happening way more? I see it a lot more myself, like different ads or experiences around it, but what are you noticing in that world?
I think telemedicine is great. I
Uh-huh.
believe in the product. I think it's something that I use. I love using it because it's
Mhm.
so convenient.
Yep.
During COVID, that was the only way that you could see a doctor.
Yep.
But utilization's gone back down to almost pre-COVID levels. And
Ah.
before COVID, it was pretty low. And it's not just with us, it's for other health systems as well that I've talked to.
Mm.
And there are some things that you would rather just do in person. Having your doctor see you face to face, I think, is definitely part of the care that it's going to be really hard to get rid of that experience. Is it?
Yeah.
Is it going to change still and change some more? Absolutely. But is it going to be where the majority of our patients will be seen virtually? I don't think so. And I'm willing to bet on that. But I know that's a lot of attention's going towards telemedicine. And it's again, another example, if we really did our research, if we really asked the patients and kept the patient at the center, hey, if you want to go see your chiropractor or orthopedic surgeon, would you rather, instead of just asking them, see how they do it, and most of the time they want to go see the doctor in person and show them,
Mm.
like, hey, this is where it hurts my back, or what have you. So
That's good. Yeah, I think it's like almost like yeah, like a yes and kind of thing. Like yes, telemedicine will exist. It's and to your point, I do not think that one-on-one connection, in person in real life is going to ever go away. I agree. I
Yeah,
think that will always be an element. There will be some technology plays where telemedicine and telehealth can really support the next evolution of things, but I agree. There's some stuff I know for me, like I just want to go. I want you to look at this thing on my arm. I don't want you to, I
exactly.
want you to look at this weird whatever. So
Yep.
that's I totally get it. I would love your thoughts on there was a Deloitte article. I don't know if you saw this. It was on the
Hmm.
global marketing trends. The authors shout out to Andy Haas, Michelle McGuire Christian, and Ravuth Kuki. The article is titled "Supercharging Customer Service with AI." And it's got
Hmm.
this claim that this rising marketing trend in 2022 is to combine AI and human interactions to create this smoother workflow within the company and build a much more effective marketing strategy through
Yep.
data collection. Are you
Yep.
noticing this trend at Summit Health? If so, can you give us an example?
We definitely talk about it a lot, and we definitely have been noticing this trend. Just because it's the big trend of 2022, healthcare probably will pick up on it in 2032. But I would say that it is absolutely something that we talk about quite often. So that's where we would love to combine our patient experience from a issue resolution standpoint, right? If you have a question about your bill or if you have a question about a prescription, a lot of times AI could probably handle it through a chatbot or directions, what have you, or appointment rescheduling. But there are some things that a person absolutely needs to handle, and I don't think we're there yet where something as complicated as healthcare and health records, where an AI bot could probably answer those questions. So it's a combination of the two for sure. That is something that we're looking at now. How
Hmm.
do we combine AI plus the human experience? Again, trying to make it as seamless as possible. And that's what I loved about that article too. By the way, it's just putting the customer at the center, putting the human at the
Yep.
center of it all. And I know this is not just a healthcare issue of not doing that, but I really do think as an industry like ours, it's just imperative. Otherwise, we're just wasting money and,
Hmm.
and, and time.
What do you think is like in terms of just marketing trends? Like anything else you're noticing in healthcare or noticing in your world in terms of trends?
Well, so there was this trend called consumerism in healthcare, and my boss at Summit, he's one of the pioneers of consumerism, which
Okay.
is really thinking this crazy concept of thinking what consumers would want instead of what the company would want first. And
Mind blowing.
I know it's we're 2022 folks, and we will sometimes argue where the pendulum's probably swung a little too much, right? Similar to what you and I were just talking about these gadgets or telehealth, or like, oh man, consumers will never want to see us in person again, or never would want to talk to someone on the phone again. That's not true. It's consumerism is about putting the consumer in the center, right? Not just going and building things and using technology that we think are cool to come up with ideas that someone thought of and spending a lot of time and money trying to build it out. And so a lot of our research actually that we've done ourselves shows that a lot of the things that people want from a healthcare company we already know about, right? Like they want to get better. They don't want to have to wait. There's just basic things that we should probably focus on first that we already know that we do a terrible job with. I always come back to this idea of just making the experience right and that's what I think consumerism is. It's making the experience as seamless as possible, but doing it in a way that puts your shoes in the consumer. Hey, in this situation, would I really want to talk to a chatbot? Or in this situation, would I really want to go through an online scheduling tool versus talking to someone on the phone? Because I'm calling for my mom who is sick, who doesn't, who can't really talk that well. I'd rather just talk to someone on the phone, right? And so why are we pushing people away from the phone so much? And when we should be making it easier to talk to someone on the phone. But everyone else who doesn't want to talk to someone on the phone, let's make that easier as well through different tools. But I think to kind of wrap that up in a little sentence, it's we're trying to make it a hassle-free experience, but we do a really good job creating hassle at the same time.
I
And
love it.
that's just how healthcare is today in our country, and it'd be pretty cool to be able to change all that.
Yeah, well, you're definitely in, a full contact sport. That is like the middle of the healthcare, and the evolution of healthcare. Like you're in the middle of it,
Yeah,
and so thank you for that. I'd love as we close out, just kind of your final thoughts for, kind of
sure.
two buckets of people that we know listen to the show. What's your final thought for someone who's coming up in the ranks and they want to be a marketing leader like you? And then what are your thoughts just for someone who's already at that spot, maybe in a different industry? Just kind of anecdotally, what would you like to drop the mic on at the end?
It's my mic, so I don't know if I want to do that.
That's right.
But
Keep it actually
for
on.
someone,
But yeah.
I know. All right. So for people that are up and coming and have that hunger, it's kind of what I said earlier. It's being able to tell concise stories with data, but not do a vomit of numbers, and build credibility, build trust, speak about what you know. And if you don't know, then say you don't know. If you're wrong, and then own up to it right away. But it's about building relationships, and you build relationships through credibility, and you build credibility through being able to sell internally and convince someone that you know what you're talking about. For people who are probably a lot smarter than I am and a lot more successful, don't do what I do. That's probably what I would say to them. And that's why they're there. And honestly, it's just let's not forget about who we're actually trying to serve. A customer, the customer's customer. Always, always, always put yourself in their shoes. Sit in your call centers. Spend a day in your call center. Spend a day in your office. Spend a day in your front line, or getting at UPS. I had to deliver packages, which was a completely mind-blowing experience. Just make sure that you always get the perspective of all the different people that you're asking things to do.
That's awesome. Well, Andy, this has been an incredible conversation. I appreciate your time and your energy, your efforts. What a cool path you've had so far. I know that it's not over yet. You have an adventure ahead of you. But thank you for being
Knock
on
on wood.
Marketing Trends, man. Thank you. This was awesome. We appreciate
This
you.
is awesome. This was really fun. Thank you so much.
Hey everyone, thanks for watching. Please subscribe to this channel for more great marketing interviews with today's top industry leaders. And thank you to our partners at Salesforce. Salesforce brings marketing and engagement together. Head over to salesforce.com/marketing.